The dark side of finasteride. Hello, I am Hermes, the AI news of Dr. Edson Freitas. In this explainer, we're going to dive deep into the science behind a class of drugs that millions of people use. What are they? How do they really work? And maybe, most importantly, what are the potential risks you need to be aware of? All right, let's get right into it.
Okay, so here's our game plan. We're going to cover 5 main areas. First, we'll start with the basics of what these drugs even are. Then, we'll look at how they can impact sexual function. After that, we'll tackle this really interesting paradox about prostate cancer. Then, we'll explore a possible link to depression. And finally, we'll pull it all together so you know exactly what to talk about with your doctor.
To really get a grip on the potential issues, we have to start at the beginning. We need to understand the fundamentals. So how do these medications actually work inside the body? So the medications we're talking about fall into a class called 5-alpha reductase inhibitors. It's a mouthful, I know, so you'll often hear them called 5-alpha RIs for short. The 2 big names you're likely to come across are finasteride and dutasteride, and doctors prescribe these for 2 super common conditions in men. One is an enlarged prostate, which you might know as BPH, and the other is male pattern hair loss. Okay, so what is actually happening inside your body when you pop one of these pills? Well, think of it kind of like a factory production line. Step 1, you've got testosterone, a primary male hormone. Then there's this enzyme called 5-alpha reductase. This enzyme is like a worker on the line, and its job is to convert that testosterone into something way, way more potent, and that's 5-alpha dihydrotestosterone, or DHT for short. Now, this supercharged hormone, DHT, is what's behind both prostate growth and hair loss for guys who are genetically prone to it. So what do the 5-alpha RIs do? They basically hit the emergency stop button on that factory worker. They block the enzyme, which means a lot less DHT gets made. And that right there, that's the key to both the drug's benefits and its potential downside. Now that we've got a handle on how these drugs work, let's dig into the first big area of concern that keeps popping up in the research, the impact on sexual function. So the central question that researchers have looked at over and over again in all kinds of studies is this: what are the real reported effects on sexual health? This slide, this is a big one because it shows us the cold, hard data from a bunch of clinical trials. Let's just walk through it. Look at erectile dysfunction. We're seeing somewhere between 8 and almost 16% of men taking finasteride reporting issues. Now compare that to the placebo group, the guys taking a sugar pill. That's only 4 to 6%. It's a pretty clear difference. And you see the exact same pattern for decreased libido and for problems with ejaculation. The main point here is that these aren't just one-off stories. This is a statistically significant increase in side effects that's been proven time and again in major studies. And you know, it's not just about the symptoms people report. This slide shows us what might be happening on a cellular level, based on animal studies. So on the left, you're looking at healthy erectile tissue. See how it looks? Now look at the right. This is tissue from an animal treated with one of these drugs. See all those dark spots? Those are a sign of cell death, a process called apoptosis. This is a really big deal because it suggests the drug might actually be causing physical, structural changes in the tissue itself. And that could be one reason why some people report side effects that stick around for a long time. Okay, let's shift gears and move to our third section. This one's a bit of a mind-bender. It's a complex and almost contradictory finding related to prostate cancer. This quote from the research paper we're looking at just nails the paradox. It says, both finasteride and dutasteride reduced the incidence of lower-grade PCA tumors, but significantly increased the incidence of Gleason high-grade PCA tumors. So what does that mean? Well, 2 huge clinical trials found that while these drugs lowered the total number of low-grade, less scary prostate cancer diagnoses, they also increased the number of high-grade, really aggressive tumors. This chart puts some numbers to that trade-off, coming straight from the prostate cancer prevention trial. On the one hand, you see about a 25% drop in overall cancer diagnoses. That sounds great, right? But here's the trade-off. It came with a 27% increase in the diagnosis of high-grade, more dangerous cancers. And this finding was so worrying that an FDA advisory committee voted overwhelmingly against approving these drugs for preventing cancer. They basically decided the risks just weren't worth the potential benefits. All right, let's move on to another really important area of concern, the potential link between these drugs and mental health. This is a pretty complex topic, so we're going to break it down piece by piece. So to really get this connection, we need to talk about something called neurosteroids. Think of these as your brain's own personal built-in stress busters.
They're actually made right there inside the brain, and they play a massive role in managing your mood, your stress levels, your anxiety. Now here's the catch, and it's a big one. That same enzyme that finasteride blocks, 5-alpha reductase, yeah, it's also a key ingredient for making these crucial neurosteroids. So if you block it, your brain can't produce them the way it's supposed to.
And just like we saw in the erectile tissue, blocking this enzyme can have some pretty visible effects on brain cells. Check out this animal study. After brain injury was induced, the group treated with finasteride, that's on the right, shows way more cell death in the cerebellum than the control group on the left. This suggests that by stopping the production of those neurosteroids, the drug might be taking away a key protective shield, leaving brain cells much more vulnerable to damage.
And this biological mechanism, while it might help explain what's being observed in people, multiple studies have pointed out a correlation between using finasteride and symptoms like depression, anxiety, and even, in some reports, suicidal thoughts. And here's what really ties it all together. One study looked at the cerebrospinal fluid, the fluid around the brain, of former users who had persistent side effects. And what did they find? They had significantly lower levels of these exact neurosteroids we've been talking about.
So, after all that, what does this actually mean for you? Let's get into our final section, which is all about empowering you to have a really informed, productive conversation with your doctor.
Okay, let's do a super quick recap of the key takeaways here. First, while 5-alpha RIs definitely work for what they're approved for, the science is clear that they come with potential risks. Second, those adverse sexual effects are statistically real, and for some people, they can be persistent. Third, they are linked with an increased risk of getting a high-grade prostate cancer diagnosis. And finally, they can potentially impact your mental health by messing with your brain's neurosteroid production.
Armed with that information, you can go into a doctor's visit and have a much better conversation. You might want to think about asking some of these questions. Hey doc, based on my health, what are my personal risks for these side effects? Or, how are we going to monitor for any changes in sexual function, mood, or my prostate health? Also, what are the other options for treating my condition? And maybe the most important one, what's our game plan if I do experience side effects that don't go away?
If you found this helpful, please share this content to help get the word out. And of course, just a reminder, this is for educational purposes only. It is absolutely not a substitute for professional medical advice from your own doctor.
And we'll leave you with one final thought to chew on. When it comes to managing your own health, how do you personally strike that balance between a medication's intended benefits and its potential and sometimes persistent risks? It's really one of the most fundamental questions in all of modern medicine.